Hello, everyone. Today we have a fantastic speaker. Her name's Céline. She's the co-executive director at Lafiya. Lafiya makes family planning services accessible in northern Nigeria by distributing Sayana Press, a 3-month injectable contraception. She has previously worked as head of fundraising and program manager in Kenya, as well as in Lesbos, Greece. Celine has taken part in the Charity Entrepreneurship Incubation Program, summer 2023, and which is aimed at launching highly effective charities. Celine has graduated from the University of Cambridge with a master's in philosophy in psychology and education. So just to introduce a bit what Lafiya is doing, Lafiya is a nonprofit organization empowering women in rural Nigeria by providing essential family planning information and access to contraception. And in this talk, Conquering the Valley of Death, Building Runway for Your High Impact Charity, Céline will share insights into Lafiya's strategy to attracting sustainable funding while navigating the Valley of Death. She will explore how Lafiya is building trust with donors in the early stages of launching an organization. Céline, over to you.
Thank you. Good morning, everyone. So I want to start this talk with a question. Who of you has, in the past year, worried about having enough runway for your initiative? I'm assuming at least some of you do, or otherwise you wouldn't be attending this talk. And I can personally attest that it can be stressful to both work on launching your initiative, making sure your program runs well, while at the same time ensuring that enough money comes in to be able to run sustainably. I know this firsthand because, like Sue said, I'm the co-executive director at Lafiya Nigeria. So Lafiya is a global health organization working in family planning. And I'll give you a 1-minute recap of what we do before we dive in further. So we provide last mile distribution of contraception to our clients. Some context of northern Nigeria. In Nigeria, family planning products are scarce. Women might line up in long hours in line for a health clinic to only find out that the commodities are stocked out. Or if they did receive stock, the clinics often don't have any trained healthcare professionals available. So we aim to bridge this gap by delivering a 2-day training to nurses and midwives employed by the Ministry of Health. And then after this training, we give them unlimited stock of Sayana Press, which is a 3-month injectable. They can then distribute this during their work in the clinic, and the nurses also go on outreach to very remote areas to truly bridge that last mile. And because the nurses are already living in the communities where they work, they have built up a lot of trust with their clients. So we see that this is a successful model, but of course we do need money to run our operations. And so today I'll be exploring some lessons that I've learned in the past year while running Lafiya and while ensuring that we have sufficient runway to move forward. So we have started Lafiya in 2021. Clau, my co-executive director, launched Lafiya and gained some initial money from donors, as you see on the left. In the beginning, you might have some people giving individual donations to you, enough to launch a small pilot and get some proof of concept. In the beginning, you'll be very stingy and you'll be very careful of how you spend every dollar. However, at some point, maybe after 1 or 2-ish years, you notice that your program is growing and that you need a lot more money to sustainably run. You need to hire some staff, you need to invest in your monitoring and evaluation, you're increasing in size, so you might need to buy more product, you might need to engage more in advocacy, or whatever model you're pursuing needs more money. However, you're not yet established enough to attract the big bucks, right? Let's just say Mackenzie Scott hasn't found you yet, and the multi-million-dollar checks aren't coming in yet. So when you do look for opportunities for funding, you might see that you don't qualify, that there are a lot of restrictions to the opportunities. And there's this valley between, the large established funding opportunities and the money that you got into the beginning of your organization. Your startup funding is drying up. So how do you proceed? That's what we'll be exploring in this talk. As a disclaimer, with Lafiya, we're still very much in this mid-stage situation. So I don't have any absolute wisdom, but in this talk, I'll be sharing some of the lessons that we learned in the past year. And we'll be sharing some solutions that we found, and I hope they'll be useful for you too. So let me give you some context of Lafiya first. With Lafiya, we were lucky to receive some startup funding. My co-executive director, Clau, won the D Prize in 2021, which was enough to run a small pilot targeting about 2,000 women. Then we went through the Charity Entrepreneurship Incubation Program, where Clau was looking for a co-founder, and I joined the initiative last summer. We received intense mentoring from the CE AIM program, and we got enough seed capital to run our org for another 8 or 9 months of runway. So with these funds, we were able to hire staff in Nigeria, to invest in our M&E, to train a bunch more nurses and midwives, who we call Lafiya sisters, and to scale to additional states in Nigeria. Most recently, my co-founder Clau was selected for the Mulago Fellowship, which came with a lot more mentoring and a program that's really focused on helping you scale. So we scaled up a lot in the last year, and for 2025, we'll be raising $1 million. This is a 3-fold increase from our 2024 budget, and so it's quite a big jump for us. And in this jump, we've learned a lot of lessons that I'll be sharing with you today. So specifically, I'll be diving into 5 lessons that I've learned in the past year. And because I'm working in the global health and development context, this is also the examples that I'll be giving. But I'm sure if you're working in a different cause area, you might be able to modify them to your context. So my first lesson is you really want to have a clear view of your impact. And this statement comes in 2 pieces. The first piece is you want to have a clear view, and the second piece is you want to have impact, right? Let's start with the second part first. You want to have impact. So if you look at this graph, the cost effectiveness of interventions in global health, you want to be as far to the right as possible, right? So you want to ensure that you're working on a large, neglected, tractable problem, and that you're implementing a cost-effective solution that is working for your population. So first things first, if your model is not impactful enough, it will be really difficult to fundraise. And the better your model is, the easier the money will follow. So you want to make sure that for every dollar that you invest, there'll be a measurable impact on people's health or well-being. But how will you know this? If you're just starting out and you're just launching your solution, how will you know that you have this measurable impact? So that's how we get to the first part of the statement, the clear view. You'll need to get your hands dirty, start working on your solution, and then measure. So the expectations for an organization that has just started out will be very different than the expectations for a mature org that has been operating for 10 or 15 years and that has a multi-million-dollar revenue. So as you're just starting out, the expectations on the hierarchy of evidence that you'll need to present to your donor will be very different. And as you'll go, you'll see that you'll be able to climb up this pyramid or this hierarchy of evidence, and that you'll be able to demonstrate more to your funders and to your supporters. So once you've settled on the problem that you're going to tackle, you'll want to talk to some experts, right? You'll want to consult some people in the country that you're hoping to run. You'll talk to maybe professors in the field or people who've done it before, and you'll gather some information on how you might be best able to implement the solution that you have in mind. Once you've settled on which solution you think will work best, you might want to run a small pilot. So you'll collect data on your work, you'll talk to users, you'll set up a data collection app, maybe you'll even be able to pay some enumerators to collect data for you. So as an example, for Lafiya, we spoke to many people in the family planning sector, including other implementing organizations like MSI and JPIGO. We spoke to the government, both at the national level as well as on the regional level. And we spoke to researchers doing family planning work. Of course, we also spoke to the people that we want to help most. Then once we set up the pilot, we were able to reach over 2,000 women, and we collected data on each and every one of them in the data collection app Survey CTO. This pilot gave us some initial data on how many people are we able to help for how many dollars, and what kind of problems are they facing, and what problems might family planning be able to solve. So we see that reasons for women to use contraception might be they want to have a break in between births. They want to take part in paid employment. They want to finish their education. So these are all kind of evidence that you're tackling the problem that you want to tackle. We also created a first cost effectiveness analysis. This was still quite conceptual because in the beginning, you're still gathering data. And so you might have to discount a little bit on the exact effects that you're tackling. We supplemented this cost effectiveness analysis with research on what other family planning programs have done in sub-Saharan Africa, what effects they have reached, and what we could reasonably expect from our program. These are rough numbers, but then again, we had just started, right? In the past year, we've then done two things to move further up this hierarchy of evidence. We've done this both on a practical and on a theoretical level. So first, on the practical level, we've done a quasi-experimental field study to measure the increase of modern contraceptive rates in the region where we operate. So we've selected 2 experimental regions and then matched them with 2 control areas that were similar in some demographic aspects. So we did a pre-measurement in all these areas, then implemented our program for 6 months. And then next month, we're actually going to do our follow-up measurement. And hopefully this will get us information on the effects of our program, the counterfactual effects. So this is how we made another step up the ladder of evidence. We also commissioned Rethink Priorities to conduct an independent cost effectiveness model of our work. So this is more of a theoretical study where we get a sense of the cost per averted DALI and how much it costs to prevent one unexpected pregnancy with our model. So we had done a CEA ourselves, but it's always different when you have your own assumptions and you have your own view of the work versus when someone else, an independent person or agency, conducts an analysis of your model. So we found it very helpful to talk through our model with the researchers, talk through the assumptions that we had made in our CEA, and also see how they found our model and what they thought of the research that was already being done and how relevant that was for our work. So from this, we got a really nice analysis that has also recently been posted on the EA forum of our expected cost per DALI. And because we're still scaling, we had this done in quarters. So we had an estimation for each quarter in 2024, and then a projection for our work in 2025, so that we can see as we keep scaling how the impact will scale with us. Engaging in this research, both practical and theoretical, gives us a better sense of the counterfactual impact of our work. Let me see. Yeah, so we're slowly starting to think how we can move up on that ladder of evidence. So we're starting to think, what if we would do an RCT? What would that look like? What would be necessary for that? But before we start an RCT, we want to make sure that our model is the absolute best model that we could have, right? So in 2025, we'll be running some small pilots on our work. Some things that we still want to explore include the effect of male engagement. So currently we see that husband's disapproval is one of the main factors of women not wanting to uptake contraception. So we'll be running some small pilots, including men, and counseling them as well, and seeing how this will improve our impact or not. And once we think that we've settled on the best possible model that we have, that is cheap, that is simple, but that is very high quality, then we'll be able to move towards an RCT. And the main point of this is that you want to share your evidence and you want to signal that you're doing your research to the donors. So when you're just starting out, your evidence might be smaller. It might be your own data collection app, or it might be stories from the field. And then once you're advancing, you want to make your evidence more robust and you want to signal credibility to your funders. And once your organization grows, the expectation for your evidence grows. So you want to make sure that you're both increasing the quality of your model and that you're increasing the quality of your M&E. And when these steps increase, you'll be able to grow your donor base and meet the expectations that there are from your donors. So these are really good things to flag and invest in. My second lesson that I've learned over the past years is that you want to combine fast and slow money. And what I mean by this is that I think everybody is kind of reaching for that big multi-million-dollar contract eventually. But getting there takes time. And what you don't want is that you're only focusing on that big goalpost on the other side of the valley of death, and that you'll run out of runway by the time that you're almost there. So you want to combine money that comes in faster with money that takes time to build relationships and that comes in slower. So as an example for Lafiya, at the top left, you see Pivotal giving out many millions of dollars. They request 2 years of audited statements. We don't have that yet. We have annual accounts, but they're not audited. So this is an opportunity that will be in the future for us, but that we're not currently eligible to apply for. That means we need to look elsewhere. A party that we're also looking at is USAID. But at the moment, as it stands, we don't have connections there. And it will take us some time to build up relationships, to find an opportunity that is suitable for us, and then go through the 9+ months of due diligence, right? So these are both types of slow money that we have on our radar, but that we're not able to act upon immediately. So then at the bottom, you see some faster money. Bottom left is the Embassy of Switzerland in Nigeria. They give out seed money for organizations that have grassroots projects. And we applied with them. We explained a little bit about our project. We created a budget, and within 2 months, our project was approved and the funds came in. So this is very fast money where, you know, once you've identified the prospect, you can act upon it very quickly. And surely the amount is lower, right, than you would get from a USAID. But at the same time, this does give you some runway, and it does give you the opportunity to build your program out to a larger scale. At the bottom right is the Lalor Foundation, which is a foundation focused on family planning specifically. And this had 2 proposal rounds. So the runway needed was a little bit longer. It took us about 5 months from initial contact to getting approved. But what we saw here is that we were able to apply with less conditions attached. So we didn't need to provide our previous annual accounts. And we were able to explain in large detail our proposal and our work. And that was enough for them to have some trust. And so what you want to do is build your initial base of people that are higher trust, and that want to give you, let's say, between $20,000 and $50,000, to build out your program, generate evidence, signal more credibility, and then at the same time work towards, okay, what do I need to eventually apply for the larger pots of money? In the meantime, you don't want to come across as desperate or push people too hard for funding, right? Because what you'll see is the large, more established foundations, they don't want to be pushed, and they probably will not change their timelines for you. So you will need to ensure that you have different streams and different opportunities running in parallel at the same time. The short-term donors that can also be very good to build up your runway are high net worth individuals. You may network with them at conferences such as these. You may find them on the EA Forum with Marginal Funding Week, which is happening right now. And you might find them in areas outside of EA. These can also be really good funders to help you build some runway. And this way you can have your core operations funded while you start working towards the goalposts that are necessary to apply for bigger opportunities. Then something else we've learned is to see funding as catalytic, and in the meantime, to think about your end game. So initially, it may seem like the easiest answer to who will solve this problem is you. You will be providing this service forever. However, it's often not sustainable to keep providing a service yourself forever, even though initially it might seem like the most logical thing. Most of the problems we try to tackle with effective altruism are enormous, right? They're massive in scale. So you may not be able to grow large enough to fix the entire problem, or fixing the problem may take decades. The problem exists in many different countries and contexts, and affects many people who would potentially require different solutions to fix their problem. So you may not have sufficient funding to keep going forever, because after you've survived the mid stage, getting millions of funding might not necessarily be easier. So the lesson here is think about who will deliver your solution at scale. How can the service that you're providing be built into sustainable systems? That can be, you might want to convince the government to take over your model. You might want to create an open source solution that other organizations can copy. You might want to work with implementing partners who you can train to implement your solution at scale so that you can work into many different geographies at the same time. You might want to, once you've established your proof of concept, switch to a for-profit model where you can fix a market failure initially and then get it going for profit. There are many different ways in which you can scale exponentially rather than linearly. But what I would recommend is to think about this very, very early. It's often much more attractive for people to fund catalytic funding, so to give you a push and to then reach exponential scale, than for you to come to them year after year after year and say, hey, do you want to donate again? We're still doing the same thing. So with Lafiya, our end game is transferring our operations to the government. We want to prove that we can build a model that is cheap, that is qualitative, and that is simple to implement, and that helps a lot of people for a very small investment, so with a high return on investment. And once we've built this infrastructure, we're planning on engaging in advocacy with the government. The government is already highly involved in our model, so the nurses that we train are employed with the Ministry of Health. The Ministry of Health is engaged in our monitoring and evaluation efforts. And the person that trains our Lafiya sister is the family planning focal person from the state. So we're already building this collaboration, and we're setting the stage for the government to eventually take over operations of our model. This means that the story we tell to funders is, please give us this push to bridge the mid stage and to bridge the time until we can engage the government sustainably. And the story is not, please fund us for the next 50 years while we try to tackle the whole problem ourselves. I think that's a very different narrative that you're telling. And so my advice would be, think about your end game early. Another lesson I've learned is to be highly transparent about the challenges that you're facing. So it's tempting to want to look good and to maybe think, oh, I might not tell funder X about this problem that I've had. They might think that I'm weak, or they might think that I'm not able to handle my organization well, or they might think that I'm messing up. And what I've come to notice is that many funders actually really appreciate hearing about the challenges that you're facing, as long as you're talking about it in an empowered way and in a solution-focused way. So they know that you're working on a challenging problem, right? If it wasn't challenging, 100 other people would have solved it already. So they know that you're getting your hands dirty and that you're doing the best you can, but that there will be hurdles. And they'll enjoy hearing about them, because when they hear about the challenges you're facing and in the work that you do, they know that you're engaging with the problem on a deep level. So you're still in the mid stage or even in the early stage. You're not expected to have the ultimately perfect solution. You're allowed to still iterate and improve your model and make some mistakes. I think funders even enjoy helping you figuring out your challenges. They might have some expertise that you haven't had before, or that you can use to look at your problems from a different angle. And they might enjoy talking with you about how to potentially solve this issue. So the main challenge that we've been encountering recently is our supply chain of DMPASC. So as an example, we distribute the Sayana press or DMPASC, the 3-month injectable, for free, right? And what we've noticed is that it's increasingly difficult to buy it in country. The supply chain is quite challenging. So at the moment, we've been talking to UNFPA to see if we can buy through official UN channels directly. And we've also been talking to Pfizer to see if we can buy from them directly. We expect to have an alternative supply chain set up within the next 3 to 6 months. And in the meantime, we're branching out to different in-country suppliers to ensure that we have sufficient parallel channels to buy our contraception from. So this way of framing the challenge and talking about it in a solution-oriented way shows that you're ready to tackle the problem at hand, and also builds trust on that you'll share with them when things go differently than expected, but that you're there to take on the challenge and ensure that you'll do your best to weather the storm. A last thing that I found very helpful in building Runway is to remain flexible in your expenditure. So what you don't want is set these super, super ambitious goals for the next year and then halfway figure out that you're actually out of money and that you have to shut down. So what we do with Lafiya is we have 3 different scenarios. The scenario on the left is to stay at our current size of operations. So for us, that will be 240 Lafiya sisters in Nigeria going forward for the next year. And that will be able to distribute a bit under 200,000 doses in the year. Then our mid-scale scenario is that we'll be able to grow to 400 Lafiya sisters, which means that in the geographies where we currently are, in the 4 states that we're operating, we'll train more sisters, but we won't be able to branch out to new geographies. And then the optimal scenario that we'll be fundraising for is to grow both in size in the states that we're already in, so go deeper into those states, and also to branch out to new states or potentially even a new country. And in this scenario, we'll be able to distribute over 300,000 doses and invest, of course, more heavily in training and expansion as well. So this way we can switch our operations around based on the level of funding we receive. So if we receive more funding, also, for example, in the beginning of the year 2025, we know how much we can scale up with this level of funding. This helps us in assessing our runway and prevents that we run dry before we're able to fundraise again. As a finishing note, I want to mention that I think people tend to be too scared of fundraising, and that they see it as some kind of necessary evil. And they see it as this way of begging for money, and oh no, what if people say no? And what if they think that we're not doing the right thing or we're not doing it the right way? I'd like to challenge you to reframe that mindset and start seeing money as your fuel for impact and the thing that greases your motor. And if you're applying for the opportunities that are the right fit for you, you will see that your funders are actually there to support you. And they bring the money, but they also need you to bring the expertise, to bring the hard work, to bring the local context and the knowledge that you have. So together you are able to make an impact, right? They bring the one thing and you bring the other thing. And together you'll make the puzzle pieces fit and achieve an impact. Thank you so much.
Yeah, Céline, thank you so much for your talk. That was so wonderful. Hopefully, we can take a breath here. Folks, just to remind everyone, you can use the questions function, and I'll be going through the questions based on the highest upvotes. So, yeah, let's see if any questions coming in. Let's see. All right. All right. So the first question is by Claire. Claire asked, how do you decide when is the right time to do an RCT? Is it only after you think you have a model that is highly cost effective and likely to find a big effect?
Yeah, so obviously we want to be ready to do an RCT when we start it, because it's a big investment, both in terms of money as well as time. So what we've been doing is do some quasi-experimental studies first. So the study that I mentioned that we're currently doing in the field and that we'll be doing a follow-up study, follow-up measurement in December is one of them. And then we'll be looking at those results to see, okay, is this kind of the direction that we were expecting and the level of effect we were hoping to see? If it is, that's the first positive sign that we'll be moving forward. If it isn't, we know that we'll have to change our model and tweak it to get the level of effect that we want. A second thing that we're going to do is we're going to do a process evaluation study in the upcoming year. So at the moment, our model is kind of a big black box where, okay, we input training and Sayana press, and what comes out is hopefully an increase in modern contraceptive uptake. But what is inside that black box? What are the mechanisms for impact? Is it that we're distributing the product for free? Is it that we do the training? Is it that we solve supply chain issues? Is it that we use the hyper-localized health workers, right? What are the crucial elements that are really necessary for this impact? So that's still an answer that we're searching for and that we're hoping to get through doing the process evaluation study. And then another element was the rethink priorities cost effectiveness study. So I think these kind of building blocks, when all these lights are green and the signs are pointing in the right way, that's when we know we'll be ready for an RCT. If any of the findings are less positive than we thought or than we hoped, then we know we have to tweak more before doing an RCT.
Thank you, Celine. The next question is by Paul. Paul asked, do you foresee Lafiya transitioning to supporting the government to secure international philanthropic funding to allow them to absorb those operations? If not, how do you understand the government to take over the procurement and distribution at scale with their existing financial constraints? I can repeat the question.
Yes.
Yeah.
Yes, we indeed do that. So we hope to be able to work with large multilateral funders, big aids, so to say, and to at least connect some of the state governments that we're working in with those funders, so that they can be funders at scale and the government can be doers at scale. So we do hope to make that connection and to build those networks.
Okay. The next question is by Chan. Chan asked, when you are planning on doing the RCT, how do you make sure that the disadvantages of RCTs are minimized, i.e., the ethical problems when your solution has already been proven to make an important positive impact? In other words, not giving your solution to the control group, which will negatively impact them at their futures. Yeah.
So at the moment, a lot of the geographies are not being reached at all. I mean, yes, they are a control group, but there are also many other areas where we're not working that are also not getting those benefits. And I think we can offset some of those negative consequences by going into these geographies as soon as the RCT is over, right? So you're doing your research for a set amount of time, let's say X number of years, and then after the research is done, you can give them the services. And maybe prioritize them over other areas that you haven't ventured into yet. So that way they can still benefit from the work that we do.
So the next question is from Leah. Leah asks, did you perform an estimation of your overall impact on fertility and population growth in the areas you're working? How do you take that into account looking at your impact?
So we do look at the total number of children had prior to when we go into an area to see if it would be a high impact area to work in. So this is something that we do take into account. At the same time, it is not our goal to reduce fertility in any way. So we take it as more of a metric of, okay, there is not a lot of family planning services available yet. But it's not our goal to reduce fertility. Our goal is that women feel empowered, that they have the opportunity to space their births if they want to, so that they are able to take ownership of their own life and potentially engage in paid work or in finish their education if they want to. If they still want to have a lot of children, that's their right. And we, in that sense, do not have any view of whether that's good or bad, are agnostic in that sense.
Okay. The next question we have is from Solomon. Solomon asks, are there any cultural or religious pushback on your works? If there are any, what strategies have you found to be effective in navigating such challenges and gaining community acceptance?
Yeah, so we do work together a lot with the regional government. So like I said, the family planning coordinator is the trainer of the nurses. So we engage them to be the facilitator of the training that we host. We work a lot together with the Ministry of Health. So for example, we work together with the Ministry of Health to select the areas that we'll be venturing into that have the highest stockouts and the highest unmet need. We also, on a very local level, work together with the community heads and the town criers, so to speak. So they will be mobilizing women when we are doing an outreach. They will let everyone know that we are coming and that free services can be accessed. I think the most pushback that we're seeing is kind of on the family level, where husbands will not allow their wife to access family planning services. At the moment, we are not tackling this directly, although men are always invited to come for counseling sessions. They're always welcome if they want to. But in 2025, we do plan to run pilots with this. So what we want to do is host male engagement sessions where there is a male facilitator who talks about the benefits of family planning for his wife, and who hosts kind of community sessions where men can talk about their worries and their fears, and these can be addressed appropriately to hopefully also break barriers on the family level. But on an overarching, let's say, government level, we haven't received a lot of pushback.
I see. The next question we have is from Claire. How do you decide? Oh, sorry. If working with big funders like USAID, USAID, or UN bodies, how do you balance the trade-off between them having strong or rigid views about the model versus delivering the program you believe in?
So we might be a bit too early stage to answer this because we haven't actually gotten funding from these large bodies yet. But so far, we've only worked with funders that believe in our model and that trust us to do the work that we do. And that's also the path that we intend to keep taking, right? So we pitch our model, we gather evidence. This is the best way to tackle the problem. And we work with funders who trust us and who trust the research that we've done and the signposts that we're gathering. And so we have never changed our model for any funder, and also will not do this in the future.
Okay. The next question, so we're down to our last 3 minutes, folks. So the next question is from Veronica. Thanks for sharing. Could you talk a bit more about the for-profit focus Lafiya could use to become self-sustainable?
So this is not a path that we are venturing into. I was just mentioning it as different types of end games that are possible for nonprofits. We work with the very bottom of the pyramid, the people who are surviving on less than $2 a day. And we see that these people are also least able to pay for services. So we are not pursuing a for-profit model. Our product is free and will also remain free. So that's the for-profit strategy is not one that we are pursuing, but it is an option for charities.
Okay, I think those are all the questions we have. I wonder if Céline, I just want to throw it back at you. If you have any, final words you'd like to say, maybe like some things, some follow-up action items that the audience can take to galvanize into action. Over to you, Céline, for final last words.
Yeah, thank you so much. I've really enjoyed giving this presentation. Feel free to reach out to me over email or Swapcard or any other mechanism if you want to chat a little bit further about this. And in the meantime, I want to encourage you all to fundraise hard because your project is worth being funded. And in the beginning, it can be very difficult, right? You can end up in this vicious circle of no money leads to not being able to do your project, leading to not being able to fundraise. But there are ways to break out of this. And once you are able to fundraise your first $1,000, I'm sure that you will do a tremendous job in launching your project. Feel free to reach out if you want to chat about this further.
Yeah, and if folks want to chat with Céline, there's an office hours happening right after this. So we'll give Céline like a few minutes of break. Do catch her at the office hours. I think with that, that's all. Thank you, folks. Thank you all. Thank you, Céline.
Thanks.